Hi, my name is Catherine Price. I'm a physical therapist. Today I'm going to talk about rehab of an overused shoulder with overhead activities. If you are concerned about any of the exercises or have questions, please consult your doctor or physical therapist for the appropriateness of the exercises for you. So in the athlete who is going to either throw a baseball, throw a football, or play tennis or have a volleyball overhead hit, we're looking at repetitive use of a arm or shoulder, and usually there's going to be a dominant side. When you're looking at this person, you may see that one side is more developed than the other, and that is from a repeated contraction. So we want to go through and address any of the muscle tendon unit problems from the overcontraction of those muscles. And I want to start with a scripture from Psalm 62, 5 through 6. Yes, my soul find rest in God. My hope comes from him. Truly, he is my rock and my salvation. He is my fortress. I will not be shaken. All right, so I'm going to begin with my release, stretch, and strengthen. So we want to release the muscles that are overcontracted. We want to stretch them to restore their movement or restore their muscle tendon relationship, and then we want to strengthen to re-educate. Now, with the repetitive use of the shoulder, we're going to look at all the muscle groups that are potentially overdeveloped, release them, stretch them, and then look at the muscles that are underdeveloped. And a lot of times the scapula stabilizers can be the underdeveloped muscles. So what 2/3 of your shoulder movement is going to come from the glenohumeral joint, so what we would consider shoulder. The scapula, the shoulder blade, anchored against the rib cage, 1/3 of the movement is going to come from there. So the beginning is going to be the releases. The tools that I'm going to be using, I am going to be using a roller, a foam roller. I'm going to use a little bit of a smaller, more firm roller. I'm going to use a lacrosse ball. And any form of a, you can use a cane, you can use an umbrella, but I'm just going to use this stick to help me with my stretches. And then I'm going to have a towel roll. So the first muscle that I'm going to work on releasing is going to be my posterior superior serratus, and that's going to elevate the ribs. So if I'm looking from behind, or and I see that one side is being lifted, there can be a number of reasons for that, but when we inhale and lift the arm to make the movement, that posterior superior serratus, which is going to be up high, is going to lift the rib cage, and we want the rib cage to be down so that the shoulder blade is positioned downward and doesn't cause the tendons on that shoulder to be compressed. There are bursts in between the tendons and the bone, and they can be irritating. So let's start there. I'm going to take my lacrosse ball. I'm going to place it right, if I find the upper part of my shoulder blade, I'm going to go right inside that, place the lacrosse ball. I'm going to lie onto my back with pressure there, and I'm going to bring my elbow so it is directly towards the ceiling. Now I'm going to lift my bottom so that I can put more pressure in that region. If this is really contracted and there's trigger points in the muscle belly, then it's going to be uncomfortable, and you may just rest right there. You want to stay on that until it decreases in discomfort or pain. About 70% reduction in pain is a good rule of thumb, but it may take, depending on how overcontracted it is, it may take even days before you start to see some changes, so it can be quite uncomfortable depending. And so I'm going to start there, and I'm just applying pressure and holding that. Going up, I'm going to go about 1/2 inch upward, 1/2 inch downward, staying in a small area. And I want to work my way down as I go right below a little bit, still staying on the inside of the shoulder blade. I'm going to work my way down. So I'm going to be getting into the rhomboid minor, rhomboid major. Those are going to hold the shoulder blade towards the spine. And so I'm going to release any of the muscle tension in that region. And anywhere that is tender, you want to hang out and spend some time on that area. All right. Once I have spent time to release the muscle tension and notice that there is decreased tenderness, I'm going to move on to the next muscle group. And that is going to be on my side, my infraspinatus and my teres minor. So I'm going to feel a bone on the shoulder blade, and that is going to be the spine of the scapula. If I go right below that, that's going to be my infraspinatus. That is going to be one of my external rotators of my shoulder. So when I'm bringing my arm up and back, I'm going to be activating the infraspinatus and teres minor, especially the infraspinatus. So we're going to release the tension there. And I want to keep my head and neck relaxed as I'm doing this. So I'm going to place my lacrosse ball right below that spine of the scapula. And I'm going to bring my elbow just out in line with my shoulder. And I'm just going to put pressure down onto that lacrosse ball. And this can be intense just to have pressure applied, especially if that muscle has been overused, and posture. So if I'm sitting with my shoulders rounding and lengthening that back portion, you can develop trigger points just from poor posture. So then I'm going to take my hand and I'm going to rotate the shoulder internally, externally, and this can be intense as well. And I'm just loosening and releasing the muscle tension in those muscle bellies. Now I can roll down slightly. As I come down, I'm going to run into my teres minor. And then below that's going to be teres major, and that's an internal rotator. So as you're overhead throwing and as you're following through, you're going to constantly be internally rotating the shoulder and working that muscle. And about 15 times taking a rest, 15 more is plenty for the rotation to release this. So I'm just working on that. And anywhere that I feel tenderness, I'm going to hang out a little bit longer and just hold and try to release the tension on the back side of my shoulder blade. And trigger points can refer pain along the arm, so you may feel some referred pain. If you get tingling that stays, you want to come off of that area. There's 3 cords on the brachial plexus, and the posterior cord is going to come out through your teres major and teres minor, and that's going to supply the radial part of nerve in the arm. So we don't want to hang out on the nerves. We want to be on the muscle belly. So the rule of thumb is to release, stretch, and strengthen. So after I have released my rotators, I'm going to take my stick and I am going to then go into external rotation, and I'm going to stretch my shoulder. Now I've done a good job releasing the backside, so I am not feeling the stretch as much as I normally would if I were doing this cold or did not, or was working on really tight muscles. But when you're doing this, you should feel the stretch on the back side of the shoulder. That's the muscle group that you're getting at. Your teres majors, internally rotator, and you are holding that muscle into a stretch position. And you want to hold this for about 30 seconds, and I want to do 3 of these. So I'm going to come out of that. Then I'm going to go right back into that. Now there's 2 elevators to the shoulder, the supraspinatus, which is a rotator cuff muscle, and the deltoid. And the interesting part of this teres major internal rotator is that it attaches to the humerus but can blend in with the connective tissue of the supraspinatus. So there is a lot of overlaying connective tissue in the shoulder. It is a complex joint, and there's a lot going on, so it's important to address many muscle groups to get at, I call it an orchestra of problems, or an orchestra that plays to make a movement. We're going to hold this. So this is my external rotation stretch using a cane. And that's going to be done after I release the backside. So I'm going to relax out of that. All right, you should feel the shoulder is getting a little bit more limber. Next, I'm going to go into my lat subscap foam rolling. So I'm going to go just along the edge of my shoulder blade. Underneath that shoulder blade is the subscapularis muscle. It's a rotator cuff. It's an internal rotator cuff muscle. And then I'm going to, my lats are going to go all the way from my back and attach up into the intertubercular groove on the humerus. So that's going to be also along the side there. So I am going to apply pressure onto the side, and I'm going to go all the way up into my axillary region, into my armpit. And then I'm going to roll down, staying along the ribs. So I want to stay on ribs. I don't want to go off the ribs. And then I'm going to roll slowly and coming up. So releasing the tension on the side of the shoulder there. And trying to take deep breaths to relax into. And you can rock backwards and forwards along anywhere on this line and find different areas that need attention for releasing the tension. And it takes about 2 or 3 minutes to get the connective tissue to relax, the fascia. So I'm on my lat, and I'm going to roll back down, get some of that subscapularis muscle. And after I have spent time on the lat and subscap, I'm then going to take that right arm, reach behind my back, and I'm going to push the elbow down to get a stretch on the side. Then if I lean to the side, I can get more of a stretch through that lat. And I'm just going to hold this for 30 seconds. If you're having any shoulder pain in these positions or during these exercises, please do not do them. You're going to experience pain and tenderness over trigger points, but if you're getting pain that is not going away as soon as you take pressure off or come out of that position, you do not want to be doing that. That is irritable pain, and that is something we want to avoid. So there is productive pain and unproductive pain. If pain persists after you've come out of that position, then it is unproductive. And I'm just holding the stretch. Ten more seconds. And then relax. And one more. And you can do these stretches cold or do them before you've tried a release and see the difference. It's more effective to do the release and then go and do the stretch. And I want to stay relaxed. Then next, so with our throwing, we're going to engage the pec muscle. So I am going to release the pecs. We're also with our bent elbow, and if we follow through into a pronation, your supinator is going to be eccentrically controlling that. And a supinator, one of our supinators is the biceps. So we want to release the biceps and also release the pec muscle. So to release the pec, I'm going to take my lacrosse ball. I'm going to lie onto my stomach, and I'm going to, your pec minor, pec major. Pec minor, there's a coracoid process, little bone on the front, and it's going to be its attachment point, and then the muscle belly is going to attach to the ribs. So I'm going to place my lacrosse ball just on my upper portion of my chest region, and I'm going to rest my forehead. And I like to take my arm and I can hold it out and I can make a snow angel with this right arm. So I'm bringing it down and up but keeping it rested onto the floor so you can see this. Now I can move side to side too to find the different regions on my chest wall that have more tension. And when I find that area of tension, I'm then going to rest onto it. And then I'm going to bring this arm down and up in a snow angel. And if I find an area that is tense or tender, I'm going to hold it there. And I'm just going to hang out there and release the tension. Don't forget to breathe. You can take deep breaths, trying to relax into. And again, if I spend 2 or 3 minutes on each muscle group, that's a good amount of time. Okay. After I've released my pecs, then I'm just going to go take the lacrosse ball, keep my elbow extended, and I'm just going to work along my bicep and just applying pressure. And you want to go slowly. This isn't something you want to go through quickly. So after I have released my pecs and my bicep, I'm then going to go and do a combined stretch. And so if I go in grab this edge of a door, I'm going to then take my body and I've got my hand turned down this way. So I'm going to rotate my hand down, hold the inside, and then I'm going to rotate my body as I keep my elbows straight. And I should feel a stretch in the chest and then down the bicep portion of the arm. So I'm just going to rotate and hold that stretch. Again, 3 times 30 seconds. I'm going to rotate out of that. I'm going to shorten this, but you want to hold for a good 30-second count. I'm rotating my body. As I extend my arm, I'm going to be able to get more of a stretch through the chest wall. If there's pain on top of the shoulder, please don't do this. I'm going to relax out of that and then go right back into for one more. And I rotate my torso just to get that chest stretched as well. And then I'll get more of a bicep stretch. Okay. So that's going to be the combined pec stretch as well as the biceps. So now I'm going to, if I'm looking from the front and I am constantly elevating that arm, I'm using supraspinatus and deltoid. And sometimes you can see the deltoid more developed on one side. So if I am right arm dominant and I continue to do repetitive overhead movement, I am developing that deltoid. So I'm going to release that. So deltoid is going to attach down to the deltoid tuberosity. I've got the middle, the anterior, and the posterior. And I'm going to go right over that deltoid. I'm going to keep my elbow into my side, take my lacrosse ball, and I'm going to lie onto that muscle belly. And I'm going to keep my head supported, my head and neck supported. And with this, I'm actually going to use as much support as I need to for my head and neck. And then I'm going to apply pressure to that deltoid. Again, if this is an overused, overworked muscle, it can be intense. And all I'm doing is putting pressure onto it. And I'm going to keep my elbow into my side as I do that. So my elbow is into my side, and I'm just going to sink down and apply pressure right onto that deltoid. And it can be quite intense. Again, you want to hang out here. You can hang out for 2 or 3 minutes. And you want to just hang out to where you can. You don't have to force it. And you can relax up out of that. Go right back into it again. You're just working on releasing the tension on that deltoid. I'm going right onto that muscle belly, and I'm going to keep my elbow into my side. And I've got that right under the deltoid. And I'm going to get some of the roll to the front slightly, and then I'm going to come and get more towards the back portion. Okay. After I've released the tension on the deltoid, I'm just going to bring that right arm and just bring it across. And the nice part about this is I am not getting much of a stretch because I have effectively released that muscle tension. So that is the release and stretching portion of my right shoulder girdle. So at this point, you should feel like you have released the tension in the right shoulder. Now we want to do the strengthening phase. So we are going to work on the scapula stabilizers, and the first one that I want to do is going to be our trapezius muscles, our mid and low trap. I'm going to use a towel roll. I'm going to rest my forehead down. These are called Blackburn exercises. I'm going to rest my forehead here. Palms are going to be facing down towards the floor. Pull my shoulder blades down and back, and then I'm going to lift and hold for a count of 5. 1, 2, 3, 4, 5. Relax. Shoulders go down and back. 2, 2, 3, 4, 5. Relax. Shoulder blades down and back. 3, 2, 3, 4, 5. Relax. Shoulders down and back. 4, 2, 3, 4, 5. Relax. 5, 2, 3, 4, 5. Relax. 6, 2, 3, 4, 5. Relax. 7, 2, 3, 4, 5. Relax. 8, 2, 3, 4, 5. Relax. 9, 2, 3, 4, 5. Relax. And 10, 2, 3, 4, 5. Relax. Moving on, mid-trap. My thumbs are going to be facing upwards. I'm still resting my forehead onto my towel roll. I'm going to squeeze my shoulder blades together. I'm going to anchor them down and then lift. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And take a pause, deep breath. And then I'm going to do another set, anchoring the shoulder blades down and back and lifting, squeezing my shoulder blades together, lifting the elbows towards the ceiling. 4, 5, 6, 7, 8, 9, 10. And take a pause. Now I'm going to work on my serratus interior. My serratus goes from underneath the shoulder blade and it attaches into the ribs. It's my boxing muscle, so when you're bringing your arm forward, you're protracting the arm, you're going to be using the serratus interior. So we can start, I'm going to do 20 of these, and it's just a rounding. I'm going to push up, and then I'm going to relax back down. And to add arm strength to it, we can add a push-up and then a full rounding. So I'm pushing through the heel of my hands. 1, 2, 3, 4, 5. Rounding up. 2, 2, 3, 4, 5. 3, 2, 3, 4, 5. 4, 2, 3, 4, 5. 2, 3, 4, 5. 5, 2, 3, 4, 5. 6, 2, 3, 4, 5. 7, 2, 3, 4, 5. 8, 2, 3, 4, 5. 9, 2, 3, 4, 5. 10, 2, 3, 4, 5. Halfway there. Fifteen, 2, 3, 4, 5. 16, 2, 3, 4, 5. 17, 2, 3, 4, 5. 18, 2, 3, 4, 5. 19, 2, 3, 4, 5. Last one. And rounding. 20, 2, 3, 4, 5. And relax. Now, the next one I want to do is going to be a plank with a rotation. And so I'm going to go onto my elbows, and I don't want to be hanging onto my shoulder blades. I want to be able to keep my elbows pushed, so I'm activating that serratus interior. I want to keep my shoulder blade flushed against my rib cage and then rotate. So I'm keeping my shoulder blade flushed, and then I'm going to rotate. And I can do this on the wall before I do this on
the floor, so you're just up against the wall. Now, to proceed that, if the shoulder blade is not staying anchored, you just want to begin with side planks. And so, if I'm going to do my right shoulder, I'm going to go right onto my right side, and I'm just going to go into a side plank, and I want to keep the shoulder blade flushed against the rib cage as much as possible. So I don't want to drop down and have that shoulder blade off. I want to push through my elbow and hold myself up here. Hold for a count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. We're going to hold for another count of 10. Push through the elbow. Hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And I'm going to do one more. I'm going to push through my elbow and hold right here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. Now, once you're able to hold that, go into your plank on your elbows and then do the rotation part. 1, 2, 3, 4, 5. And then I'm going to go over to the right side. 1, 2, 3, 4, 5. One more count of 5 each side. 1, 2, 3, 4, 5. And last on this side. 1, 2, 3, 4, 5. And that concludes the strengthening part for the scap stabilization after working on the release and stretch of the overused arm for overhead throwing. I hope this is of benefit to you, and have a blessed day. Thank you.